Although we don't know how much money we're going to get within the NAHLN pillar this year, we're very excited to have our foot in the door, to be successful with whatever we get, and we'll hopefully have the amount increase over years. So for PPQ, for plant protection and quarantine, they now get $80 million a year, and they started out in a very similar fashion that we're starting now. So the potential is immense. Some of the things that you would think about that the NAHLN would take on could be brand new, but keep in mind that what I'm going to go over in my talk is what we do day to day, and I feel like there's a lot of opportunity to support what we're doing day to day with this money as well. We don't have to make it big and different, new and different. We can do day to day. So to start with a story, back in 2002 we had 12 laboratories in the NAHLN. We were a partnership between USDA, APHIS, and NIFA and AAVLD. That partnership is still there, still very strong. But today, we've expanded to 59 laboratories across the United States. We cover 42 states and include 17 level 1 labs this year. So every year, we're increasing the number of level 1 laboratories, which is our highest lab. They do the most work. They have the highest expectations. We have 27 level 2 labs this year and 7 level 3 labs. So our list of level 3 labs is shrinking as our level 2 and level 1 lab groups are expanding, and that's exactly what our restructure in 2015 had hoped to accomplish, was that the labs were increasing their abilities and their capabilities year after year. We do have one affiliate lab, the USGS lab in Madison, Wisconsin, that does some testing for us as well. So the purpose of the NAHLN hasn't changed since 2002. We're here for early detection of high consequence disease through targeted surveillance. Once a disease has been identified, the expectation is a rapid response through surge capacity, and then eventually appropriate recovery, which is a high level of testing to prove disease freedom, basically for our trade partners. So again, what we do day to day supports primarily those first two purposes of the NAHLN. Currently, we have 14 diseases or agents under our scope, meaning that if a laboratory wants to test for these diseases through an active surveillance plan or to test sick animals, they have to be approved by the NAHLN. Then they have to be approved specifically for that disease. We provide them with a standardized protocol, and their analysts have to be annually proficiency tested to do that testing. We break the diseases down into 3 groups. We have our active routine surveillance. 9 of the diseases or agents are under that group. We have a group of what we call preparedness, which I'll say currently we don't have active surveillance plans under the NAHLN for those diseases, but we have labs approved, proficiency tested, and standing ready to do any of that testing on sick animals. And then we have, of course, our response to outbreaks. And to accomplish what we accomplish day to day, we have 4 working groups. The working groups are composed of members of the NAHLN laboratories that have expertise in these different areas, as well as members of the reference laboratories at NBSL, and then members of the NAHLN program staff. Currently our most active working group is the Methods Technical Working Group. They review and approve, or recommend, I should say, all of the protocols that are used or deployed to the NAHLN labs for all of the diseases that are under scope. If any changes or increased efficiencies or new technologies or need for a DIVA test come about, they would go through this Methods Technical Working Group looking at the scientific nature of that test to make sure it's adequate. And then they would make a recommendation to our NAHLN Coordinating Council to accept or not, maybe keep it in the toolbox but not deploy it, those kind of things. And then the Coordinating Council would make the final recommendation to our Executive Committee. But again, all of our technology, all of our protocols go through the Methods Technical Working Group. Next we have the NAHLN Exercises and Drills Working Group, and this working group is expanded recently. We provide webinars, informational webinars to the NAHLN labs on topics of preparedness, We had a webinar last week on creating zones during an outbreak situation so that the laboratories have some understanding of how that happens in the field, how samples are prioritized in the field, so that once they get to the laboratory, they can be prioritized into whatever the laboratory already has going on. And then they also develop and provide exercises and drills to all the labs to, again, increase that preparedness level. We have a non-IT working group where all of our IT individuals that don't necessarily interact with us on, what we do day to day come together and talk about things like electronic messaging. So that's one of our huge priorities right now, is to have laboratories gain the capability to electronically message test results. And that group has done a fabulous job in ramping up the ability of most of our laboratories to do that now. And then finally, we have a non-portal working group which manages our secure means of communication with the laboratories. So again, those working groups provide a lot of direction and support for us to meet our activities or our requirements, and those activities include meeting requests for action in veterinary service initiatives, for participating in the active and passive surveillance plans out there, increasing preparedness. We're always working to increase preparedness, and of course to respond to any outbreaks that are out there. So I will start with the initiatives that we've been included in. So we've had 2 national level initiatives from VS that the NAHLN has been included in over the past few years. The first is the National List of Reportable Animal Diseases. NAHLN was, and Dr. Tomlinson especially, was in early discussions of how to implement this piece into the laboratories. It's currently working its way through the regulatory process. Once it becomes implemented, we're going to have a huge task of encouraging and supporting the laboratories to be able to electronically message all of these diseases. So we've got a long list of reportable diseases as well as a long list of monitored diseases. And the hope is that all the labs will be able to provide those test results to those that need those test results real-time electronically. Another national action plan that we're involved in is for antimicrobial resistance. It's a mouthful for me. The NAHLN has initiated a pilot. We're in our 2nd year of that pilot, having laboratories work to gather and report AMR profiles of animal pathogens. So we're working on a means of gathering that and reporting it in a way that we can take it back to the veterinary community and help them to make informed decisions with antibiotic use. We're also very involved in validation projects. So as you can imagine, as you probably know, all protocols that are deployed to the NAHLN labs must be validated. And the NAHLN labs are set very well to do the negative cohort portion of any validation project. So looking at that diagnostic specificity, and we've been involved in many validation projects. Most recently, we've been asked to evaluate by the swine industry to evaluate our PCRs for ASF, CSF, and FMD for oral fluids. So we had 4 of our NAHLN laboratories provide testing for the negative cohort. No false positives, all is good, and we've moved on to the positive cohort portion of that validation. NAHLN also sits on the VS Training and Exercise Program, which develops both local, regional, and national level exercises. So we do have some input in that. The laboratories can all participate. We did participate in our first national level exercise last year with the RMR FMD functional exercise. Got a lot of good feedback about interaction not only between laboratories and the reference labs, and laboratories and the field staff. So I think through that hot wash, the states that were included gained a lot of insight in what they need to do to improve their preparedness both locally and regionally. We also plan to take part in the African swine fever exercise, the functional exercise that's going to happen in September of this year. We've been involved in the tabletops and the planning so far. We're actually going to expand our portion of that functional exercise to include all NAHLN labs and exercise electronic messaging through that process. And of course, we're part of disease outbreaks. So there are a couple of significant outbreaks that we've been involved with recently. I'll go into a little bit more detail about those, but that's the HPAI outbreak of 2015, and then more recently the Newcastle disease outbreak that started in California. We have also been requested to, NAHLN labs have been requested to participate in wildlife surveillance. So on an annual basis, NAHLN labs provide avian influenza testing in wildlife species, and we're also part of the chronic wasting disease testing in wild cervids. We've also been called to support testing of endemic diseases that become endemic diseases when necessary. So we've been called to act in more of an active surveillance process with PED and Delta Corona, and then just in the last couple years, we've been called to act more so in the passive surveillance process with Seneca Valley. So we've had, well, I'll talk about that later, but right now we're looking at a huge expansion of foreign animal disease investigations or passive surveillance through the NAHLN because of these type of diseases. So surveillance, another huge area that the NAHLN supports, both the active surveillance, which you see here. There are 9 diseases for which the NAHLN provides active surveillance. We've got the agent and the disease listed over to the left, the number of NAHLN labs that are approved for the active surveillance portion, and then the approximate number of annual tests that those laboratories provide. So you can see that not all NAHLN labs are approved for each disease. We narrow down that list to meet the need, basically, the interest from the labs and the need from the government. And then we provide those samples, and for most of those, we do reimburse the testing. The Methods Technical Working Group is highly involved in the active surveillance programs because as program staff, as our commodity staff within VS identify, again, new technologies, new sample types that need to be evaluated, new efficiencies that need to be considered, all of that comes through our NAHLN Methods Technical Working Group for evaluation and recommendation. And then for our passive surveillance or our foreign animal disease investigations, we've got a bit higher numbers of labs that are approved to do this testing because we have a surge capacity. We've identified all labs that have the interest and the ability and are proficiency tested to do that testing, and then in the case of an outbreak, we can call on any or all of these laboratories to do that type of testing. And again, we do reimburse for that through the NAHLN. So moving from surveillance to our work to increase preparedness, there are several areas within preparedness that we focus on. One of those is response time for the laboratories. So keep in mind that the NAHLN testing that our laboratories do is just a small part of what they do day to day. That's their bread and butter. So we really want to be kind of on the front burner at all times for them. So we send out requests for information, and we disguise that as drills. For instance, if Plum Island has to shut down because of weather, oftentimes we'll send an email out that same day saying, Plum Island cannot test. We need to know that you can do the testing for us should we need it. Let us know how many FMD, CSF, or ASF tests you can do based on the number of primers, probes, and controls you have on hand. And we ask them to provide that information back to us as soon as possible. And typically we get responses by about 95% of our labs within 24 hours, which I think is phenomenal when you're talking almost 50 to 60 laboratories responding. The most recent one we had a couple weeks ago, we actually added ASF to that, and because we've got so many new labs that are ready to test for ASF, I think we lagged a little in our timeline, so we only had 90% of the labs respond in 24 hours. Still pretty good numbers, though, I think.
Who's the slacker?
I'll tell you, and you won't be surprised it was California. They're a little busy right now. we did cut them some slack, but we had to put them on the chart. Okay, so another area within preparedness that we really try to exercise with the labs is their lab workflow. So in order to respond to an outbreak, it's better to expand your current workflow than to make any big changes. So we really try to work with the labs to figure out the best ways to make their workflow scalable. Okay, so we're working on annual exercises to address these. And some of the areas are barcoding and messaging for sure, and then using enhanced BSL2 or BSL3 space in the face of an outbreak. So those are the kind of things that we're addressing, and the kinds of things that the exercises and drills working group are coming up with, these topics to try to exercise for the labs. And then, of course, reporting. This has been huge for us. We've really worked hard to increase the ability for non-labs to report real time and report electronically and get that information to the decision makers as soon as possible. Of our 59 labs, we currently have 47 that are capable of electronically messaging. It's been a bit of a struggle, as Dr. Tomlinson knows very well. She's started this whole process years ago. Because our laboratories have different LIMS systems, because the vendors of those LIMS systems often make changes that the labs aren't always aware of, that can affect the ability of that lab to message test results, there's always ups and downs. So we're working really hard to standardize our message, standardize the response to issues, the way we troubleshoot, and then exercise. Again, exercise. Trying to get the labs to practice that messaging. We are upping the game as far as the approval for labs. By the end of this fiscal year, by the end of this fiscal year, all level 1 labs will have to be able to message all non-diseases for which we can receive a message. By the end of next fiscal year, all our level 2 labs are going to be required to be able to message. And then even our level 3 labs are going to be held to this requirement a couple years down the line. In order to support them, we again have our NAHLN IT working group. Anybody from the laboratories is welcome to be a part of that working group and ask for help. We've created a mentor program where, again, particular LIMS systems have their own quirks. So if a laboratory is very successful with messaging and has one LIMS system, any laboratory that has that same LIMS system can go to them for help. So things like that. We've also created messaging competencies, which are basically proficiency tests for messaging. We provide quarterly proficiency tests for avian influenza and foot and mouth disease, and then for the other diseases for which we can receive a message, they're biannually, semi-annually. And we can currently 1, 2, 3, 4, 5, 6, 7, 8. We can currently receive messages for 9 of our diseases. So, and again, we're pushing the exercises of having labs assume that they're going to receive 300 samples in a day and being able to message out those results in a day, and figuring out how they're going to be able to handle that within their own system. How can they scale their system? So those kinds of things have been very successful. And just to point out one area where we have really pushed our preparedness, and I'm very, very proud of the network for stepping up. But with African swine fever, it wasn't very long ago that we weren't even talking about African swine fever. This time last year, we had 8 laboratories that were approved to do that testing. 8. Right now, we have 44 labs, and that's been over since August to January. We went out and asked the labs, are you interested in being a part of this? Would you please add this to your approval? We had 44 laboratories decide to include that approval, take the proficiency test, and pass. Our capability right now is greater than 38,000 PCR tests in a day that we can do. That doesn't really talk to sustainability, I get that, but just the fact that we've been able to scale up to this level this quickly, and the laboratories are truly supporting it. And that's because their states are supporting them to do it, too, by the way. I think it's really important to bring that piece into this, that the state support is extremely important for our laboratories. We also, at the encouragement of the swine industry, increased the number of samples or the types of samples that are approved for testing in non-labs. It was that whole blood was the only sample that was approved for testing. We've increased that to include tonsil, spleen, and lymph node. Again, that went through our Methods Technical Working Group for recommendation. It went then to the Coordinating Council, and then that went to the Executive Committee for approval. So we do have our process in place, and it worked well. So currently, the testing for African swine fever is available to those 44 labs through an FAD investigation only. And we really encourage the labs to include classical swine fever as well. All the labs that are approved for ASF are now going to be approved for CSF too, so that they can do both of those tests. As far as active surveillance, that's being discussed very heavily. It's very close to the possibility of an approval, and if so, it will mirror our CSF active surveillance plan that we have in place now. So there are 10 laboratories that are doing that for us. Those same 10 laboratories will do the active surveillance for ASF. So again, a great response from the laboratories. And then as far as the non-labs responding to outbreaks, we've had a great history of the opportunity to respond to outbreaks. Locally, regionally, very wide range of states included. And it reaches all the way back to when the network was implemented in 2002, and we had that first exotic Newcastle disease outbreak. And we follow up at the bottom of the list with our current Newcastle disease outbreak. That started in California, it became present in Utah, and now is present in Arizona. And just to give a little bit more specific information about some of the outbreaks, the biggest outbreak that the country has ever faced was in 2015, and it was the HPAI outbreak. It affected 50 million birds and cost us about $100 million to respond. And as far as NAHLN's response, we had 16 laboratories involved in the testing. Those 16 laboratories tested over 88,000 PCRs and over 1,000 virus isolations. That didn't touch our capacity for a day-to-day, which was 31,000 PCRs that could be done in a day across those laboratories. So again, our capacity is there. Sustainability, we will probably have to work on, but capacity, we've got that. The majority of the labs then could electronically message. Now all of those labs can message. Again, it was the adjustment to the workflow within the laboratories to scale that up was important. Increasing the number of analysts that could test was very important, and that's where NVSL stepped up and very quickly proficiency tested individuals. And then the laboratory, this was the first time that the NAHLN Program Office was asked to move individuals from another non-laboratory to the site of the outbreak to increase local capacity. We learned some really good lessons during this outbreak that we're using now during the Newcastle outbreak. So that's very doable. We can move administrative help and we can move technical help. So again, the labs that weren't directly involved in the testing also were involved because they deployed technicians, they reviewed emergency plans, they worked towards that electronic messaging capability, and then they increased their own number of trained and proficiency tested individuals. Now moving on to the Newcastle disease that's occurring now in California primarily. So the CAS lab started this testing in May of 2018 and have been basically testing nonstop since then. And the chart at the bottom shows their basically the monthly level of testing that they've done. To date, they've done almost 26,000 PCR for this outbreak. They did request some administrative help because most of the birds that were coming in were backyard birds. So there was a heavy burden on the administrative staff to enter the accession information, right, and all that data entry. So we had laboratories offer to send administrative help there. Only requirement was that they were familiar with the LIMS system of that laboratory. And then, as I pointed out, they had requested technical help as well. So we had laboratories offer to send people for technical assistance. We identified one person. They were ready to get on the plane and head out there, only they were from Arizona. And the day before they were supposed to travel is when Newcastle was identified in Arizona. So that person couldn't go. Another story for you. That person stayed behind to help his own laboratory. California obviously understood. So we're working on another technical person to go out to California in a couple weeks, and that person will be from Cornell. Okay. So again, this is just to show you what the laboratories in the network are doing to support this outbreak. So we've got 6 laboratories supporting the outbreak. Washington State offered reagents right up front back in May. Oregon State and Colorado State both sent administrative individuals out to support the outbreak. Utah did their own FAD investigation and found birds that were positive, but they took care of that pretty quickly and traced them back to California. Arizona right now is working on doing the testing for their own FAD investigations. And then Cornell is working towards getting somebody to send out to California in a couple weeks. And these outbreaks have increased our ability to respond. We finalized an activation plan. We can activate one lab. We can activate a region of laboratories to respond. We can activate the nation of laboratories to respond. We assess equipment and reagents very quickly and can determine what they need, what the lab needs, and where we can get it for them. We also activated or finalized an activation plan for mobile labs through the HPAI outbreak. So if a state has a mobile lab, they're very interested in using it. There is a process now in place that they can use to try to get that in place. We do communicate with our commercial vendors pretty often, so that's an area that we can support the labs. And again, increasing electronic messaging and sending support to the labs. We've got that process in place. So in summary, the ability to respond is based entirely on everyday capabilities. We really need to get these labs to expand what they already have in place, and the labs are working very hard to do that. So we want to incorporate the normal business. We want to communicate between states, between the labs and the reference labs, those kinds of things, and develop that foundation and the ability to practice, and then do the continual cycle of lessons learned and improvement. So these are all the things that NAHLN does day in and day out, something that Farm Bill money could certainly support, as well as doing new and better things. But I think we've got a lot of opportunity where we have improved and where we can still improve some more.